to regulate the internet?
Absolutely.
You trust the people that got us into the Iraq war under false pretenses to regulate the internet? Do you think that makes any sense?
Well, wait a minute. I would not. The people who got us into the Iraq war
It's the government.
was the politicians.
It's the government.
In the end, yes, it's the government. But who else is going to regulate?
But if they're going to be in power and they're regulating the internet, they're going to regulate the internet in a way that suits their best interests.
YouTube doesn't allow content that spreads medical misinformation that contradicts local health authorities, that's LHA, or the WHO, that's the World Health Organization's medical information about COVID-19. So suddenly...
And I will speak in English so there are no misunderstandings. Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk,
In the end, yes, it's the government. But who else is going to regulate?
But if they're going to be in power and they're regulating the internet, they're going to regulate the internet in a way that suits their best interests.
That vaccinated people do not carry the virus, don't get sick.
That the virus stops with every vaccinated person.
The CDC is recommending vaccines for kids aged 6 months to 5 years old. Here's what you need to know.
So there are no studies, and Americans should all know this. There are no studies on children showing a reduction in hospitalization or death with taking a booster. The only studies that were permitted, the only studies that were presented were antibody studies. So they say if we give you a booster, you make antibodies. Now, a lot of scientists would question whether or not that's proof of efficacy of a vaccine.
You want to be a dead end to the virus. So when the virus gets to you, you stop it.
You're not going to get COVID if you have these vaccinations.
It's the same way they do with the banking industry, the same way they do with the environment, the same way they do with energy, the same way they do with everything. What represents their interests? There's you're talking about so much money involved in disseminating information in a very particular way.
Another question for you. The NIH continues to refuse to voluntarily divulge the names of scientists who receive royalties and from which companies. Over the period of time from 2010 to 2016, 27,000 royalty payments were paid to 1,800 NIH employees. We know that not because you told us, but because we forced you to tell us through the Freedom of Information Act. Over $193 million was given to these 1,800 employees. Can you tell me that you have not received a royalty from any entity that you ever oversaw the distribution of money in research grants?
Well, first of all, let's talk about royalty.
That's the question. No, that's the question. Have you ever have you ever received a royalty payment from a company that you later oversaw money going to that company?
You know, I don't know as a fact, but I doubt it.
Well, here's the thing is, why don't you let us know? Why don't you reveal how much you've gotten and from what entities? The NIH refuses. Look, we ask them. The NIH, we ask them whether or not, who got it and how much. They refuse to tell us. They sent it redacted. Here's what I want to know. It's not just about you. Everybody on the vaccine committee, have any of them ever received money from the people who make vaccines? Can you tell me that? Can you tell me if anybody on the vaccine approval committees ever received any money from people who make the vaccines?
Soundbite number one, are you going to let me answer a question? Okay, so let me give you some information. First of all, according to the regulations, people who receive royalties are not required to divulge them even on their financial statement, according to the Bayh-Dole Act. So let me give you some examples.
Right now, or the internet companies are rich beyond belief.
Yeah, but it's a disruptive thing that has never existed before. I think it exists, and I think where we're at is where we're at. I think we need to move forward collectively as a country with an ethic that respects truth and that appreciates opinions and reality and an understanding of things that's not necessarily possible with corporate interest involved in dissemination of information.
But there's no way to do that except through the government. There's no way that you can do that except through the government.
Why is that?
Human nature is not going to change.
But for example, 75% of kids have had the disease. Why is the CDC not including this in the data?
The government's not going to change either.
But the government is capable of change. Okay, look.
Dr. Fauci, the government recommends everybody take a booster over age 5. Are you aware of any studies that show reduction in hospitalization or death for children who take a booster?
Right now, there's not enough data that has been accumulated, Senator Paul, to indicate that that's the case. I believe that the recommendation that was made was based on the assumption that if you look at the morbidity and mortality of children within each of the age groups, 0 to 5, 5 to 11.
Right. So there are no studies, and Americans should all know this.
Okay, look, the government regulates, for example, the food supply, or it can regulate. Let's take the
food supply.
Yeah, the Department of Agriculture.
Why have they let
Health
glyphosate infestate all of our foods?
Let's take with one thing.
Yeah, but that's a problem. That's the
I
government
agree.
regulating.
Well, then we better get better politicians in them to appoint better people. I mean,
If I give you 10, or if I give a patient 10 mRNA vaccines and they make protein each time, or they make antibody each time, is that proof that we should give 10 boosters, Dr. Fauci?
No, I think that is somewhat of an absurd exaggeration.
Well,
Senator
that is the
Paul.
proof that you use. Your committees use that. That's the only proof you have to tell children to take a booster is that they make antibodies.
it's not. Again, don't let the perfect be the enemy of the good.
Right.
Okay. So let's take the SEC or take the Food and Drug Administration, which regulates big pharma. On the one hand, we've got a very safe supply of drugs in this country.
Safe.
So it's not an absurdity. You're already at like 5 boosters for people. You've had, 2 or 3 boosters. It's like, where is the proof?
Drugs are tested. You don't get too many bad drugs. Prescribed drugs.
Did we know about stopping humanization before it's entered the market? No.
25% of all drugs approved by the FDA get recalled.
Now, I think there is probably some indication for older folks that have some risk factors. For younger folks, there's not. But here's the other thing. There are some risk factors for the vaccine. So the risk of myocarditis with a second dose for adolescent boys 12 to 24 is about 80 in a million. This is both from the CDC and from the Israeli study. It's also in the VAERS study, remarkably similar for boys, much higher from boys than girls and much higher than the background. The background's about 2 per million. So there is risk and there are risks. And you're telling everybody in America just blindly go out there because we made antibodies. So it is not an absurd corollary to say if you have 10. In fact, you probably make antibodies if you get 100 boosters. All right? That's not science. That's conjecture. And we should not be making public policy on it.
In the 40s and the 50s. So there is clinical data.
But not in children.
Well,
see,
again,
here's the thing is you're not willing to be honest with the American people. So you can ask the question, you can do laboratory tests to find out who's had it and who hasn't had the disease. What is the incidence of hospitalization and death for children who've been infected with COVID, subsequently going to the hospital or dying? What is the possibility if your kid has had COVID, which is 75% of the country's had COVID, what is the chance that my child's going to the hospital or dying?
If you look at the number of deaths in pediatrics, Senator, you can see that there are more deaths
of
in
people who have had it,
pediatrics-
of people who have had the disease.
Senator, we also know from other studies that the optimal degree of protection when you get infection is to get vaccinated after infection. And in fact, showing reinfection in the era of Omicron and the sublineages, that vaccination.
But you can't answer the question I asked. The question I ask is how many kids are dying and how many kids are going to the hospital who've already had COVID? The answer may be 0, but you're not even giving us the data because you have so much wanted to protect everybody from all the data because we're not smart enough to look at the data. When you release data earlier, when the CDC released the data, they left out the category of 18 to 49 on whether or not there was a health benefit for adults 18 to 49. Why was it left out? When critics finally complained, it was finally included because there was no health benefit from taking a booster between the 18 to 49 and the CDC study.
Just 4 days back, Nepal purchased testing kits worth millions of Nepalese rupees from China. But soon, the advisor to Nepal said that many countries using the same kits are showing unreliable and controversial results. The Himalayan country's Ministry of Health and Population has advised the country's hospitals to not use any sort of rapid testing kits sent by China. The ministry has also stopped the use of other kits brought by individuals and private organizations from other sources until their quality can be assured.
In his State of the Union address on Tuesday, President Biden announced that Americans could soon order a second round of COVID-19 tests from the federal government's free test program. Most of those tests are the orange and white kits made available through a $1.8 billion agreement between the federal government and iHealth Labs, the California-based subsidiary of a Chinese manufacturer, and On Health.